Good day everyone, I am Jeline Banis and now I'm going to perform a neurological assessment focusing in Glasgow Coma scale. So Glasgow Coma scale is also known as GCS. So it is used by healthcare practitioners in intensive care unit for assessing and monitoring patient consciousness, and it is usually used for the patient traumatic brain injury, and of course use being extended drive in a critical care condition. GCS assess the rating scale with the overall scoring system of 15 as the highest and 3 as the lowest. So the scale assesses the ability to open an eye with a scale of score of 1, it is the lowest, and a score of 4 is as the highest. While the verbal response, in a score of 1 as the lowest and 5 as the highest. In a motor response, is 1 is the lowest and 6 as the highest. So this kind of monitoring using a scale would initiate whether the patient condition improving or deteriorating. It is worth noting the scale giving a Glasgow Coma level that 8/15. It is a contest of a patient condition and clinical evaluation of patient's condition, and it usually indicates our intubations. So also, Glasgow Coma scale, it is internal part of a other diagnosis and prognosis scale. So before we start, we need to check the doctor's order. So kinakailangan po natin na meron tayong, so ang ating materials na kailanganin is kailangan natin ng GCS sheets. So dito po natin ilalagay kung ano po yung score ng patient natin sa eye, sa verbal and motor scale. So after, kailangan din natin po ng gloves, the alcohol, the pen light. So after na nag-gather po natin ng ating materials, so ang gagawin po natin is magpe-perform po tayo ng hand hygiene. So after performing hand hygiene, so mag-wear tayo ng gloves. Wear na po natin yung gloves natin, i-identify po natin ang ating patients. Hello ma'am, maaari ko po bang malaman ang inyong pangalan, ang inyong age, at ang inyong birthday? Salamat po. So, maaari din po natin, i-check din po natin yung kanyang IV tag or IV name po para malaman po natin if siya po talaga yung ating patient. So, we need to provide our privacy. So, iano po natin yung door, kuklose natin, or the curtains po. So, after nun, so hello ma'am, I am Jeline Bandis, I am your student nurse for today. Ma'am, ang gagawin ko po ngayon sa inyo ay ang Glasgow Coma scale. So, ma'am, maaari po ba kayong makisama po, or gagawin niyo po yung aking sasabihin para hindi na po tayo mahirapan? Salamat po. So, we need to assess our patient. So, meron tayong 3 categories. So, assess the eye open response, and 2 is the verbal response, and the 3 is motor response. So, now we are going to start in eye response. So, when we notice that my client is spontaneous open her eyes, therefore I give her a score of 4. So, pag naman po ang patient natin ay hindi nag-open your eyes spontaneously, so I will start talk to our patient. So, good morning ma'am. Kamusta po kayo ngayon? So, when ang patient natin is nag-response po siya, bibigyan po natin siya ng score na 3. But when the patient is not respond sa our sound check, so ito-check natin the patient pain stimulus such as peripheral pain, stimulus like wheezing. So the luminar area of patient fingernail, we can elicit the pain condition. Therefore, we need therefore to check the eye response. Kukunin po natin yung light or the pen. So, iaano po natin siya sa kanyang finger. So, squeezing, didiinan po natin. So, squeezing. So, as start squeezing the luminar area of the patient and check for the patient. So, after nun, na-check na po natin. Ma'am, masakit po ba? Pag po ang patient po natin is hindi siya nag-response, gigive na po natin siya ng pinakamababang score in a 1. So, we are done to assess the eye-open response. So, we need to assess the verbal response. So, ulit po, yung score is 1 is the lowest and 5 is the highest po. So, we need to ask the patient's name. So, hello ma'am, maaari ko po bang malaman ang inyong pangalan? Ano pong araw ngayon? At nasaan po kayo? Pag ang patient po is sumagot sa ating or nag-respond sa atin, so bibigyan po natin siya in the highest score of 5. Pag naman po ang patient natin is yung parang nakakaano lang po siya ng ilang words, pero nagre-response po sa atin siya, magbibigay po tayo ng 4. And pag naman po ang patient, ang kanya pong response sa atin ay yung parang nag-gargling po or wala na po siyang masabing word, so score na po natin 3. Well, ang patient naman po is yung nakatuwid lang po yung kamay niya, so i-check din po, kasama din po natin i-assess yung kanyang feet. So pag ganun po, score natin siya ng 2. Pag ang patient po is hindi siya nag-respond sa ating tanong, so we need to give a lowest score 1. So after naman po nun, ang atin naman pong i-perform is a motor response. So mag-start na po tayo. So ma'am, maaari po ba ilabas ninyo or i-ano po ninyo ang inyong tongue? Titingnan na po natin. Maaari nyo po bang hawakan ang aking kamay? Then push. Thank you. So, thumbs up po. Okay. Pag po ang patient natin is nagawa niya po yung ating kinukumand sa kanya, so ang score po ay will be 6. If the patient naman po ay meron po siyang abnormal action, so ang score niya po is 3. Pag naman po walang response yung ating patient, the score is lowest 1. So, after assessing, ipoposition natin ang ating patient. So, ma'am, tapos na po yung ating procedure. Pag may kailangan po kayo, maaari nyo po kaming tawagin. And, comfortable po ba kayo sa inyong tayo? So, after na po natin sa patient natin ating comfortable position, i-remove na natin ang ating gloves. So, after nun, i-document po natin ang findings. So, sa pagdo-document po natin ng ating findings, so, sa bawat score po siya in each category, so, meron po tayong score, ipagpa-plus-plus po natin yan. So, pag napag-plus-plus na po natin, evaluate na po natin kung ano nga po ba yung ng ating patient. Ano yung result. So, pag ang na-add na po natin, pag ang score niya po is 13 to 15, so, the patient have a mild brain injury. Pag naman pong score is 9 to 12, so moderate brain injury lang po. Well, ang score ng patient is 3 to 8, so severe or i-assist po natin siya or in intubation. That's all for my procedure.